on diarrhea. Okay, so let's start with what is the definition of diarrhea. Okay? Diarrhea actually is the abnormal passage of loose or liquid stools more than 3 times daily. So this is the definition for diarrhea. So if you're having a loose stool, but when you're having 1 time a day, that might not necessarily consider you're having a diarrhea here. Okay, so that's the general definition. And diarrhea can be actually further classified into different types of diarrhea based on whether there is acute or is persistent or is chronic. No? Acute diarrhea typically is actually lasts 1 or 2 days, up to 2 weeks the most, right? Persistent diarrhea basically is if you have a diarrhea that's between 2 weeks to a month, right? This is less common. Very often we'll say that we either have acute diarrhea because of food poisoning issue, or we have actually suffering from some form of what they call food intolerance, which actually causes chronic diarrhea. So chronic diarrhea actually is the more common for most of us, actually, especially for those who are old, right? And for those who have actually sensitivity to a lot of food itself, right? And chronic diarrhea is defined as it lasts at least more than 4 weeks, having diarrhea more than 4 weeks itself, right? So what are actually the concern of having a diarrhea? Actually, the complication of diarrhea basically is that for acute diarrhea, the major complication actually is the dehydration, loss of body fluid itself. This can be fatal. Okay, so therefore, it is a very important consideration or complication. Then for most of us who are either suffering from chronic diarrhea, the real complication in the long run actually is malabsorption, which resulting in our body's ability to function, degeneration due to what they call malabsorption and loss of nutrients intake itself. Okay, now let's look at the causes of diarrhea. All right. So we just mentioned we have acute diarrhea and chronic diarrhea. So what are the causes of acute diarrhea? Acute diarrhea mainly are caused by pathogens. Basically, can be caused by virus like rotavirus and norovirus. Can be caused by bacteria. Some malaria and E. coli, for instance, can be caused by parasites and also can be caused by food poisoning itself. So these forms of diarrhea are very often very acute and immediate, and actually it can be very severe in terms of symptom, and it can also be fatal if it's not managed properly itself. Chronic diarrhea, the causes are more vast and more complex itself. And today we're going to discuss various aspects of it, both acute and chronic diarrhea and how we can deal with it. So for the chronic diarrhea, you can see that it can be due to inflammatory causes. This is diseases of inflammatory diseases like Crohn's diseases and ulcerative colitis itself. All right. It can be also due to functional causes, which means that causes like IBS, right, or which basically referring to causes that is unknown origin itself, all right. And then we have chronic diarrhea that's caused by malabsorption syndromes, which actually in this case, most of it are actually our food intolerance problem, like lactose intolerance and celiac disease itself. And also actually there's a class of it due to our bile acid malabsorption problem itself, right? So acid absorption is part of our actually problem of our body that does not actually recycle the bile sufficiently, all right? Right. Another cause of chronic diarrhea is gout dysbiosis. Basically, our bacteria in our gut itself actually is dysfunctional or imbalanced. It's been actually flooded with bad bacteria itself. We call it small intestinal bacterial overgrowth. In short, we normally call it it's a case of SIBO or SIBO. Right. So another type of causes other causes are basically disease-based. Basically, they are endocrine and metabolic causes, like you are suffering from hyperthyroidism, you are suffering from diabetic. Both these conditions can also contribute or causes chronic diarrhea symptoms as well. So you can see that as a whole, the causes of diarrhea are very extensive and vast, right? So let's deal with the diarrhea, the acute diarrhea first. So what is acute diarrhea causes? As I mentioned, most of the acute diarrhea causes are actually viral, which is caused by virus and bacteria. And in this chart, it's very interesting. I want you all to just sit on it and reflect on it itself. Now you can see from here that on the mortality caused by acute diarrhea diseases, that means the death resulting from acute diarrhea itself, right? And we know that now for acute diarrhea, 90% are infectious origin itself. Now, among them, rotavirus is actually one of the single biggest cause of mortality in acute diarrhea, right? Rotavirus actually is actually acute childhood diarrhea itself. Now, this is one of the most feared diarrhea for the children, for the baby itself. All right. Another virus that's also very commonly affecting us that cause diarrhea is what we commonly call the stomach flu, right? But stomach flu are caused by a virus called norovirus, and they are not as deadly. They are not as deadly, and therefore we will find that most of us actually from time to time with the stomach flu. But because it's a viral diseases itself, there's no antidote for it, no antibiotic for it. All right. Now, on the bacteria side itself, there are many bacteria, and you can see that if you look at this chart itself, typhoid, Shigella, and ETEC itself, these three are all of bacterial origin. All right, and they account for the majority of the mortality of acute diarrhea disease, which means that bacteria cause diarrhea, causing death are more prevalent and more serious. And therefore, it is important for us that in an acute diarrhea situation, we know how to recognize the symptoms of bacteria-infected diarrhea and seek treatment as soon as possible, right? Because for bacteria diarrhea, right, there is antibiotics can help in the problem, right? Not unlike the virus-infected diarrhea where there's no antibiotic can help on it. Okay, so important, it's important for us to recognize that if this talking about diarrhea, the bacterial infection cause diarrhea is more serious, and as a consequence, we should seek medical attention as soon as possible if we are infected by it. Okay, now when should we seek medical help when we are having diarrhea? So these are the symptoms that will guide you as to when you should actually seek medical attention. Important is that if you have more than 10 or more bowel movement in a day, having diarrhea that doesn't get better after 2 days, or bowel movement that are black or bloody, right? And have sign of serious dehydration, including dry mouth, dark color urine, low urine output, and feeling dizziness, right? And also, sometimes it might accompany with acute abdominal pain and coming with a high fever. These are all the signs that you should seek immediate medical attention. Do not self-medicate. Very important. For children, especially for infant and children, it's more sensitive, and you have to know that they are unlikely like adult where we actually can tell you that we are having problem with seek for doctor. They won't, right? So same thing itself. More important is that for children itself, right? If the diarrhea doesn't get better after 1 day, I think that is a sign that you should go and send the children to see a doctor. All right. Now, also have sign of dehydration. In this case, if you know urination for 3 hours, or like for baby, you look at the diaper, the diaper is dry, right? Dry tongue or mouth, crying without tears, and unusually tired or crabby behavior. These are signs of dehydration for the children itself. So it's very important that with this type of sign, and especially when it comes with blood in the bowel movement or high fever, you should seek medical attention. All right. So very important for acute diarrhea, look for signs that you should seek medical attention. Do not try to self-medicate if you're having this sign. Okay. Now, what is the management and treatment protocol for acute diarrhea? So currently, the treatment for it is actually using oral dehydration therapy and fluid management. That's the first line of treatment. And if you see a doctor or if you hospitalize, the first thing you do is they will actually apply oral dehydration therapy on you. For the severe case, you will use intravenous fluid itself. Otherwise, oral rehydrated salt formulation will be given to you to drink, all right, to prevent you from dehydration. Well, after that, then the doctors will actually, depending on the types of cause of diarrhea, if it's a bacterial cause, they will prescribe antibiotic for bacterial infection. And then they will prescribe anti-diarrhea agent if it's actually for virus causes itself. Then for people who did not seek doctor sort of treatment itself, then we would have to learn to self-medicate with active charcoal and probiotic supplementation itself. I will talk about it next slide on the treatment, self-medication treatment itself. Right? For nutritional management, this is come after you have a pharmacological treatment, right? Then how to recover from it, and what are the diet you need to eat itself. Generally, you will have to have a fluid replacement, minerals and fluid. Drink water with a lot of minerals and liquids, broths, fruit juice in it, sport beverages. These are the suitable fluid for replacement. And then take porridge and semi-liquid meals to start off, right? And then take food high in potassium, subsequently after that. Now let's go into the detail of the management, right? Now, currently, you look at this chart itself. This is a very important chart. As I say that I want you all to download the PDF file is because there will be quite a few of this particular type of table that I put forward. It's intended to summarize, give you a snapshot of what are the available options for diarrhea treatment. In here, it gives you a very clear idea of what are the treatment options you can choose under what circumstances itself. Right in here, if you look at it itself, there's a comparison of 4 diarrhea treatment. Out of the 4, to be honest, the one that I put as probiotic, which is the brown color one, actually application is for the chronic diarrhea, right? So they are not suitable for the treatment of acute diarrhea. So I put it for reference, right? For your reference. Well, let's talk about the applicable treatment option for acute diarrhea. In here, you can see that one of the options is anti-motility agent. It means medicine that slow the intestinal motility. These are actually the anti-diarrhea medication that doctor will give you. And then the other option is antibiotic. This is, in this case, is for bacterial infection diarrhea, infected diarrhea. So obviously antibiotic is to kill the bacteria itself. Then we have the third option, which is actually most often our self-medication option, is activated charcoal. Right? So the activated charcoal acts as an absorbent of toxins and irritants of our body. It's a very powerful, universal absorbing agent. Charcoal is a very powerful universal absorbing agent, and therefore you should be able to absorb all the toxin irritants that is in our stomach itself. Right? So these are actually the 3 typical options we have for treatment of acute diarrhea. Now, if you look at it itself, right, I just want to go through it, give you a few points. The speed of action for all this treatment is that anti-motility agents, the medication for diarrhea that you take, the action is usually between an hour, you will see the results, right? But for antibiotic, normally it will take a day or so for the result to show, right? For activated charcoal, in this case, the speed of action normally between 1 to 2 hours. You'll see it. So if you look at it itself, all right, most of the time, all right, now if you are having a diarrhea, acute diarrhea, and your diarrhea is not the condition that need medical attention that I mentioned before, most of us, what option do we have? Now, the anti-motility agent, which is the medication, and antibiotics, these are the options that only available when you see doctors, right? So if you choose not to see doctors and you want to deal with it itself, the only option left for acute diarrhea actually is activated charcoal. Right? Understand? Right? So activated charcoal is a very important necessity for diarrhea prevention or for diarrhea treatment, right? Especially you are traveling or you are at home. You should keep activated charcoal for this purpose, right? And what the activated charcoal can do? First of all, you actually can absorb all the bacteria toxins, right? But it does not kill the beneficial bacteria in your gut. So this is a good thing itself, right? It can also help in relieving your gas in your stomach, all right? Right. But the problem with overdose of activated charcoal actually is what? Is constipation, black stool. But most of the time, if you know how to take the right dosage, it's never a concern for that. But this is the only viable self-medication treatment available anyway. That's having adequate speed of action itself. Right, so I want to mention here is that if you look at it itself, activated charcoal, not only is actually for the purpose of diarrhea, which your dosage can be 3 to 4 capsule. The capsule is about 200 milligrams for small capsule. So you can take 3 times daily on that. But if you're having flatulence itself, then you can also take activated charcoal for it. And in this case, the dosage can be 2 capsule after meal, repeated after 2 hours. Now, if you're having a poisoning, food poisoning, you can take 10 capsules repeated at short interval as well. So it's a very good emergency medication to carry around. Remember, especially for acute diarrhea itself. Now, so important, I have a test question for all of you. Most of us from time to time will be infected by stomach flu, right? So if you're having a stomach flu, what treatment would you choose? So the answer is right in front of you. If you are having a stomach flu, which is a virus, right? Then one of the viable options is actually using activated charcoal, right? So there's no other better alternative. If you want to say that no, probiotic can help in diarrhea, probiotic does not help for acute diarrhea. Probiotic is very powerful and very effective for a lot of chronic diarrhea, which we'll discuss shortly. But then in this case, for acute diarrhea, the real one of the practical solution we have is actually activated charcoal. So learn to make use of it yourself and keep some at home readily on hand. Okay, now activated carbon pills or charcoal itself, right? Here are the details that, as I say, I will not go into it. You can actually use your download PDF file for reference. But important thing I want to mention is actually the dosage and usage of it. If you take activated charcoal, right, what are the dosage for adults? It's actually 500 to 1,000 milligrams after symptom appear. You can repeat taking it every 4 to 6 hours as needed. For children, lower dosage based on body weight, right? So generally, based on body weight of adult, if your dosage, if a children is half the body weight, your dosage is half accordingly, proportionally. You can do that based on that itself. Now, take activated charcoal with water. Take with plenty of water to prevent constipation, right? And important, because that very often we also have other medication to take, right? So if you cannot stop the medication, if you, for instance, especially a lot of us have heart medication to take itself, hypertension medication, and so on, right? So timing with other medication is that you must take at least 2 hours before or after other medication to avoid interference of the charcoal pill with the medication. So remember, these are the guidelines, right? The rest of it, whatever, you can actually download and look at, go through it yourself. Okay, now treatment for acute diarrhea, what to eat, right? That means that basically that apart from taking the medication, active charcoal, what are the things that you should eat? The first thing is actually hydration. So hydration and electrolyte replacement. That is the key, because we say that the complication is the dehydration, the major complication, right? So oral dehydration solution, fortunately for most of us, especially in the developed places where we can buy coconut water, you can buy spot beverages, these are actually the ready oral dehydration solution. So therefore, these are good things that you can drink right? To prevent dehydration. It's especially you look at 100 plus, there's a powder form nowadays. Actually, it's good to keep it, and then when you have a problem, you actually just mix with water and drink it as the oral dehydrated salt solution itself. All right. Then, of course, you can drink broths and clear soups as well. On the diet, the food to take, start with easily digestible carbohydrates like porridge is one of the best meal for diarrhea, for a starter of diarrhea. People suffer from diarrhea. Actually, porridge should be the recommended first line of what we call meal for it. Then soft cooked oatmeal as well is good itself, right? Low fiber grains, crackers, and soft cereal. Then keep away from high fat protein. Have a low fat protein like lean meats and eggs, right? Get friendly fruits and vegetables like bananas, right? Will be a very good choice for it, right? Carrots, cooked carrots, zucchini and potatoes. Probiotic and fermented foods are also good for recovery as well. What are the food to avoid? Spicy food, dry, fried and fatty food, sugary food and beverages, especially sodas and juices, all that, all right? High fiber food, this will cause problem because you actually have a problem for you, cause a high digestion problem, right? Dairy products itself, right? Avoid that during time of having diarrhea. And caffeinated drinks like coffee, tea, and alcohol should be avoided. Okay, now let's talk about chronic diarrhea. Now, the prevalence of chronic diarrhea in the general population is about 4 to 5%. However, 40%, nearly more than 40% of these patients are older than 60 years. Now, the underlying reason is because as we get older, our intestinal system, our absorption ability all goes down, right? Our metabolism go down, and therefore it created a lot of problem for us to actually, once the bile salt reabsorption also go down, and our motility go down, and therefore the bacteria grow in the intestine, right? So all this cause a condition that actually can exacerbate and cause chronic diarrhea itself, right? So in here, right, the main symptom of chronic diarrhea is loose or watery stool that persists for weeks, right? It's not really an acute form, like acute form that we have massive losing of water, but basically you have loose stool and watery stool. Sometimes you have problem after taking food, you straight away you need to look for the toilet. And these are actually the inconvenient problem itself, right? And sometimes stool may not be or may not be accompanied by a sense of urgency. Yeah, that's all. Yeah, depending on types of diarrhea you're suffering. So what are the causes? I mentioned before, inflammatory causes are diseases like inflammatory diseases like ulcerative colitis and Crohn's diseases. Functional causes are like IBS itself. Malabsorption syndromes are the food intolerance types of causes like lactose intolerance and gluten. Celiac disease are basically gluten intolerance problem, and bile acid malabsorption problem due to our bile not fully reabsorbed back by the system. Then we have the gout dysbiosis itself, the bacteria, intestinal bacteria overgrowth, and also endocrine and metabolic diseases like hyperthyroidism and diabetics. Patient also can have symptoms of chronic diarrhea. So let's look at the details of it itself. What are the implications of all this chronic diarrhea? Very important is that chronic diarrhea doesn't result in dehydration problem most often, right? They don't really necessarily resulting in the short-term problem or the problem of dehydration like we have seen in acute diarrhea. However, right, due to its perpetual chronic symptoms and patterns, right, it will resulting in malabsorption in our body and therefore resulting in nutrient deficiency. The consequence of it is that we will actually have poor health, increased mobility, and shorter lifespan. And therefore, in dealing with chronic diarrhea, right, the methodology, the approach of it itself is very different from acute diarrhea, as you will see in a subsequent slide. Okay, let's look at the different types of diarrhea first. First, the diarrhea that caused by inflammation causes of diarrhea. These are disease of inflammation disease like ulcerative colitis and Crohn's diseases. Right. So the difference between ulcerative colitis is that actually the inflammation is in near the rectum side, the big intestine side. Whereas Crohn's diseases, the inflammation can be the whole any part of our big intestine. Right. So, but both itself are actually the same. They are under the category of inflammatory bowel diseases itself, right? And what are the common symptoms they have? Is that they have persistent abdominal pain and cramping, right? Fever, especially in Crohn's diseases itself, you have fever, and very often you have fatigue and anemia because of the blood loss in here itself. Now, for ulcerative colitis itself, the disease-specific symptoms can be bloody diarrhea itself. And of course, I'm saying that since these two are identified as diseases, then you should seek medical attention for treatment generally. For Crohn's diseases, the disease-specific symptoms are basically mild ulcers and perennial fractures. Basically, if you have mild ulcers and you're having cramping and all this itself, most likely that you are suffering from Crohn's diseases because the inflammation is more internal, more widespread inside the body rather than at the end of the rectum side. So this is one causes of chronic diarrhea. Okay, the other causes of chronic diarrhea we have actually is called small intestinal bacterial overgrowth. So this is because our intestine, the bad bacteria overgrow in that, right? Now this is why. What's the reason? There is because that our food that we take, right, go through the passage of our intestine, but the passage of time is getting very slow, and therefore the waste product gets stuck in the digestive tract itself, creating a breeding ground for the bacteria. And the excess bacteria often cause the diarrhea. That's one of the mechanisms, the reason for it itself, right? What are the symptoms of these types of diarrhea itself? Very often you find that one of the very typical symptoms are severe bloating and excessive gas, which is flatulence, right? So if you're having a diarrhea accompanied with bloating and flatulence itself, chances are that you're suffering from the SIBO, right? Which means that there's a lot of excessive bacteria in the intestine itself, right? So, of course, you can suffer from loss of appetite and nausea as well. Also, you can suffer from symptom of fatigue due to the nutrient deficiency of this condition itself. Okay, what are the risk factors? That means who are at risk of suffering from the small intestine bacterial overgrowth? Age is the major risk factor. Unfortunately, the older we get, make our digestive enzyme and gastric acid become less and less, right? When we have less digestive enzyme in our body and our gastric acid secretion is getting lower and lower, then the gastric acid act as a very powerful antibacterial barrier, form for our food to go in. So, but if the gastric acid level is go down, then the ability to kill the bacteria before you go into intestine is actually affected itself. And therefore, age is the major risk factor. And most of us, as we get older, our gastric acid secretion go down, our digestive enzyme secretion go down. That will resulting in our bacterial growth in our intestine itself. Another risk factor, obviously, is our anatomy of our intestine itself. Some surgical procedure cut down the passage length of your intestine itself, and therefore, if you have a shorter intestine, or you have a surgery that have scar in there, gastric bypass, and so on, these will also contribute to the bacterial growth in the intestine itself. Now, other medical conditions also can contribute to the gout dysbiosis. In this case, people who suffer from hyperthyroidism, right, can also suffering from SIBO, right? At the same time, diabetic patient also can suffering from SIBO. The prevalent rates of people who are diabetics actually are up to 20%, also suffering from SIBO. And those who suffer from hyperthyroidism, actually 20 to 30% of them are also suffering from SIBO diarrhea. Okay? Now, most of the drug medicine-induced diarrhea can cause this gout dysbiosis and resulting in SIBO diarrhea, right? Like long-term use of antibiotics, you know that now if you use antibiotics itself, right, over time you're going to have some diarrhea, and this diarrhea is because of drug-induced. And if you're taking diabetic medication like metformin, right, it also can actually resulting in small intestinal bacterial overgrowth and resulting in the diarrhea, right? People who are having gastric reflux diseases who are taking the proton pump inhibitor, right? Also, the medication also can cause diarrhea because that you also actually can also allow the small intestinal bacterial overgrowth in the intestine. And overdose of painkiller, NSAID itself also can result in gout dysbiosis and the diarrhea as well. So there's many causes of it itself, but among them, I will say that for us, those who are not in medication generally, and if you are not suffering from diabetic itself, if there's any of these symptoms of fluctuance and cause diarrhea, most likely it's because of your age factor itself. Okay, now, so in here, so what are the complications of having suffering from the gout dysbiosis or the severe diarrhea? The real problem, the concern should be malnutrition. Because as I say, it's a chronic condition, right? It's something that for instance, as we age, our body, we cannot have enough secretion of gastric acid. There's nothing much we can do, right? So as a result, our absorption is going to go down, and it's going to result in actually malnutrition over the prolonged period. And in here, there are many reasons why what type of malnutrition it can cause. Poor absorption of fats by the bile salt, right? Poor absorption of carbohydrates and proteins, vitamin deficiency, right? And poor calcium absorption. There are many reasons in that. I don't have to go into details, but very important is that if you're suffering from gout dysbiosis and suffering from this form of chronic diarrhea, multivitamin supplementation is always recommended. So that's the bottom line for you first. All right. So very important. The reason why some people are recommended to take multivitamin, well, this is one of the very key reasons. A lot of us take multivitamin, doesn't know why or purpose. But if you are suffering from this, you are suffering from the risk of malnutrition, then multivitamin supplement is recommended for you to compensate for this problem. Okay. Now, another causes of diarrhea, chronic diarrhea, is actually we call malabsorption syndrome. In this case, it's a case of also our body's physiology, right? Because our body's bile acid, actually bile acid are secreted from our liver here, right? And bile salt is a very effective enzyme that can actually break down our food. So it aids in our absorption and digestion and absorption of food itself, right? But the bile acid itself, right, when it's secreted into our system itself, right, it will 95% of it itself is going to reabsorb eventually in the large intestine. That's supposed to be the normal cycle of bile acid recycle use. Only 5% is actually secreted out, and 95% is actually reabsorbed. Unfortunately, that our body itself, as we age, right, the reabsorption is not as good, and as a result, because of that itself, excessive bile acid trigger the colon to secrete extra water and leading to watery stool. And henceforth, if you're suffering from bile acid malabsorption diarrhea, one of the very characteristic diarrhea symptom is watery diarrhea. Right, watery diarrhea is because of your excessive bile acid trigger colon to secrete extra water, leading to the stool to be watery. All right, so this is a very typical characteristic symptom of bile acid malabsorption. And you also have you will have symptom of bloating and excessive gas. But very important is that the increased bowel frequency, especially after meals, is also a typical characteristic symptom of these types of diarrhea itself. All right. Okay. Now let's look at the bile acid malabsorption and look at it. What are the conditions that can actually contribute to also can trigger the bile acid malabsorption problem, right? You will look at this chart itself. I just want to simplify it for you. Those with the blue bar are actually basically medical surgery, right? Medical condition, medical surgery like resection, colostomy, all right, Crohn's diseases itself, microscopic colitis, bariatric surgery, and so on and so forth. These are basically medical surgery conditions that can contribute to the bile acid malabsorption because all this surgery condition itself cut short the absorption route of your big intestine. And therefore, your big intestine absorption is not effective, able to effectively reabsorb the bile and causing that problem. But there is a few conditions that you need to be aware that could also trigger bile acid malabsorption problem. One of them is IBS with diarrhea. Now, this is where most of us have a biggest problem because IBS is a very common general problem. And IBS can come with diarrhea, constipation, or diarrhea and constipation. So I will talk about it shortly later, in a few slides later. But IBS with diarrhea is one of the actually prevalent condition that have a very high incidence of bile acid malabsorption diarrhea, right? So you can see that the bile acid malabsorption is a mechanism that causing the diarrhea. But there are many conditions that contribute to that. So among them is functional diarrhea, which is also what we generally say diarrhea with unknown origin. We do not know what's the cause. So we basically say, okay, 60% of people who are suffering from functional diarrhea actually are having symptoms of bile acid malabsorption, which means that they're watery stool. And therefore, this is a very common symptom occur in a lot of diarrhea that is without known, under-knowing condition itself, right? So, okay, now let's look at malabsorption syndrome. There are other causes itself, but one of the major cause of our chronic diarrhea actually in the malabsorption syndrome is actually our food intolerance, right? So this one, I think that that's very common, very widespread. A lot of us have problem with food intolerance problem. And the food intolerance resulting in diarrhea can be fall into three categories here. You can see that the prevalence of the food intolerance caused diarrhea are very high. Basically, that is affects about 15 to 20% of the population globally. So it's very high population. In there, you can say that there are three types of food intolerance problem. One is carbohydrate intolerance, right? So these are the common one are the lactose intolerance and fructose intolerance, right? The other one is protein intolerance. This is actually the gluten intolerance and cow's milk protein intolerance, okay? Then we have the food chemical intolerance problem. This one are the histamine intolerance and saccharides insensitivity, right? So if you look at it itself, even the food intolerance itself can be also break down into carbohydrates intolerance problem, protein intolerance problem, and food chemical intolerance. But the common one, I put it that way, the common one we will discuss today, we are not going to cover everyone. It's going to be too much time to spend to cover every detail. But we'll cover the common one like the lactose intolerance, the fructose intolerance, the gluten intolerance, right? These are the common ones that we will cover today. Okay, let's look at the carbohydrate intolerance. One of the major ones is actually the lactose intolerance. We all know, I think all of us will probably be aware what is the lactose intolerance. Lactose intolerance are actually very prevalent. If you look at this chart itself, right, 65% of the global population has a reduced ability to digest lactose after infancy, right? And in the context of the Chinese children and the Malay children, in this case, this study is in Malaysia. This study report comes from Malaysia. You can see the reference here itself, right? You can see that the Chinese children in Malaysia, 92% are suffering from lactose intolerance. Very, very high percentage, right? Whereas the Malay children slightly lower, 84%. But as a whole, right, Asian population are highly susceptible to lactose intolerance problem. Right? So it's very common for Asian population to suffer from lactose intolerance. And then because of this problem itself, right? We have to learn how to deal with it and not deal with it itself. Now, what are the symptoms? The symptoms are actually the diarrhea will occur shortly after consuming dairy. These are very typical symptoms. After drinking milk, right? Things that contain milk, right? You will you have a diarrhea. You have symptoms of want to go for diarrhea itself. And then after that, you also have to suffer from severe bloating, cramping, and excessive gas itself. So these are the typical symptoms itself, right? Now, if you avoid the lactose-containing food, right, then the symptom will resolve by itself, right? And then in terms of your diarrhea, you should not see any weight loss or blood in stool. Basically, these are the distinguishing symptom for itself. So very important, right? Remember that because it affects a very high proportion of Asian population itself, and this becomes a very troublesome problem that affects us. Okay, another food intolerance diarrhea actually is a fructose intolerance. This is a carbohydrate as well, but it's a sugar. It's a sugar form. So some people also actually, after taking sugar, right, the food drinks that is high in sugar, they also suffer from diarrhea. And this is because of the fructose intolerance problem itself, right? You can see from here, right, the symptoms are bloating, gas, and watery diarrhea as well, right? And then the symptoms are dose dependent, which means that the more sweeter you take, the higher, the more severe the symptom, right? If the less sugar you take, the less severe. So therefore, in this case, to test whether you're suffering from this type of diarrhea is very simple. You can abstain from the sugar, taking sugar, and see whether the diarrhea go away. Then if it is, then you are actually suffering from fructose intolerance problem, malabsorption. Now in here, right, I also have a chart to show you that it really doesn't matter in terms of that. When you talk about fructose intolerance itself, we are looking at actually the green bar, right? So all the sweet sugar does have some form of fructose in there, right? So if you look at it itself, maybe the maple syrup have the lower amount of fructose compared with actually the honey, right? And all the other corn syrup and all the others actually are having very high amount of fructose. So if you're suffering from fructose intolerance, it is advisable that you should keep yourself, if you can, to table sugar or brown sugar or maple syrup. Don't try to take all the other types of syrup itself. Okay. Now here is where I also ask you all to download the PDF file. It's because that for dealing with the carbohydrate intolerance diarrhea, which means the lactose intolerance as well as fructose intolerance, both are carbohydrate itself. One of the recommended approach is from the dietary approach is taking the low food map, which is actually taking all the saccharide, types of saccharide, oligosaccharide, disaccharide, monosaccharide, all these saccharide is fermentable one, right? Keeping a low saccharide diet itself. Now, many food have high food map, and there are also many vegetable and food that can have low food map alternative. So I won't go into detail, right? If you have downloaded that, you can go yourself and use it as a reference because it's quite a bit to take. And at the same time, you can see that when you talk about diet itself, it's very extensive. You really have to know how to go and pick yourself to your own diet itself. But this important is because it does affect one of the most common food intolerance problems we have. So we have to deal with through the diet side. One of the solution is only through that. There's no medication to solve the problem. Remember, right? There's no medication that can solve your problem. The only way to solve the problem is through the food diet. Okay, another food intolerance diarrhea is actually the gluten intolerance, right? Quite common, but gluten intolerance there's two subclasses itself. One is a celiac disease, which we all know is gluten intolerance, but there also another one which is non-celiac gluten sensitivity. Both are actually also gluten intolerance itself, right? So if you look at it itself, right, the problem of celiac disease is due to autoimmune disorder, or autoimmune disorder of the small intestine inflammation, all right, itself, right? And both our pathology are the same. I will skip that itself. Very important is that for this group of gluten intolerance diarrhea itself, basically, if you take food that's high in gluten, you're going to have a diarrhea. And that's the bottom line itself. So the solution, obviously, is have gluten-free diet. Keep yourself to a gluten-free diet itself. So another food intolerance actually is a food chemical. This one I will just briefly go through. They are not very prevalent, but some people do suffer from histamine intolerance problem, right? What are histamine intolerance? That means that people who actually, some people drink beer and wine, especially red wine, you have problems of diarrhea, having a diarrhea, right? This is basically histamine problem, histamine intolerance problem. Of course, for people who are suffering from histamine intolerance problem itself, they should avoid all processed, canned, or preserved meat. All right. They should avoid shellfish, right? They should avoid pickled vegetable. They should avoid yeast, bread, and sourdough. As a general guideline, these are all the food that are high in histamine itself, right? So the chart have all the details for you to reference. So if you are suffering from this type of diarrhea, then you should actually know what type of food to avoid. So, okay, another diarrhea, which is actually the diarrhea of unknown cause, or we call it also called types of diarrhea whereby we call it irritable bowel syndrome, IBS, right? IBS actually, diarrhea is actually one of the subtype of IBS. IBS can be IBS diarrhea predominant, IBS constipation predominant, IBS mixed, or IBS unclassified. These are all the subtypes itself. Never mind about it. The underlying reason for people who suffer from IBS diarrhea is because that they have a problem of connecting between the brain and the digestive system in the body, right? That means the brain doesn't control your body's and digestive system. Well, there's a brain connection problem. This is supposed to be the reason for causing this problem itself. Now, this IBS symptom, I think a lot of us would know, right? That it is a symptom that's very complicated to solve, right? And they are distinguished with abdominal pain relief after defecation. That means after you pass your stool, you actually will still have pain relief, right? That means you have pain, but once you pass the stool, you will have the pain will go away. Then you also have suffering from a symptom of you have diarrhea at the same time, alternate with constipation as well. So these are symptoms that actually considered a mixed symptom, very common for people who suffer from IBS itself, right? Because the brain doesn't control your digestive system well, and therefore this resulting in all this what I call this coordination of it. So you will find that this is a common symptom in a lot of people who suffer from IBS, but very often you cannot distinguish it from any other types of diarrhea with what they call a no cause of it. Now, what are the risk factors? As I said, IBS is a very complicated, the most complicated form of diarrhea. I can tell that, right? The prevalence of it is very high. It's about 10 to 15% of population, right? And IBS is more common in women than in men, all right? Now, the risk factors are very similar to the malabsorption part of it. So you can see that gender and age, right? But people who suffer from stress and mental health are more likely to suffer from IBS. Okay, so that means that if you are having people who are constantly on stress or have mental problem, actually they are the one that actually most likely suffer from IBS diarrhea itself, right? Then of course, if you have a history of GI infection, right, also you will actually most likely suffer some form of IBS diarrhea, right? They can see the SIBO also affecting it, right? So as far as concerned, your diet also can affect it, right? It's hormone change also can affect it. It is a combination of many factors that resulting in this IBS symptom. And therefore, until today, I would say that if you want to deal with diarrhea, a chronic diarrhea form, IBS is one of the most complicated one. And there's no known medical solution to deal with IBS today, even today. That there's no medical solution that can fix this problem yet. All right, so we always will resort to what are the best supplements if you can, if you're suffering from things like IBS, right? So these are the useful supplements and herbs that have at least qualified and shown some effectiveness for us to use. If you're suffering from some form of chronic diarrhea, even though you might not exactly know what might cause it, I think that looking at this list of supplements, taking any of this list of supplements will help. You can try to take it. So among them, the first one is actually the probiotic, right? It's known. There are a lot of studies showing the probiotic associated with significant reduction in pain and bloating for diarrhea, IBS itself. Vitamin D also can reduce the GI symptom of IBS patient. Curcumin, all right, alone or combination with other medication also improve the severity of IBS as well as quality of life. And also TCM herbs called berberine, right, also have shown to be effective in improving IBS symptom, depression, and IBS quality of life. Right? So these are the 4 herbal compound probiotic you consider as a compound, it's okay. That has been proven be beneficial for people who suffer from IBS symptoms. Okay, now probiotic is particularly I want to highlight. This is one of the few last chart already. Probiotic is actually very effective in the prevention of a series of problems, including inflammation-caused diarrhea. Right. So in this case, you can see from here the chronic inflammation bowel disease itself. So this is also effective in treatment and prevention of it itself. And probiotic is very often today used as one of the adjuvant treatment for ulcerative colitis and Crohn's diseases itself, right? And it's used in the treatment for antibiotic-induced diarrhea and diverticulitis itself. Okay, so therefore, you must remember that among all the 4 herbs that we just mentioned, probiotic is one of the few that actually can be used in the treatment and prevention as well. So it's a very useful supplementation for dealing with chronic diarrhea, right? So there are a lot of studies here. I'll selectively list out quite a few studies that even the application for probiotic can be used for lactose intolerance diarrhea, antibiotic diarrhea, and chemo-induced diarrhea as well. So I leave it for you to actually take it as a reference. Okay, now what are the management strategy for chronic diarrhea? Right? So unlike the acute diarrhea, now I want all of us to sit down there and just look at it. So now we're dealing with chronic diarrhea. The first thing we have learned is that we must know how to identify and treat underlying cause. That means that if we can, we try to identify the underlying cause, right? So very often for us as a layman might not be suffice and capable of doing that, but what is the first line of treatment that is currently applied, or commonly most recommended first line of treatment for chronic diarrhea? It is in the dietary modification. It is not in is not in the medicine, right? In treatment for chronic diarrhea, the first line of treatment is actually in the dietary modification. So if you can identify your underlying cause, if your cause is IBD, then the dietary solution is low fiber diet during fasts. If your underlying condition is IBS, you take a low food map diet, right? If your problem is bile acid malabsorption, your solution is low fat diet. If you have suffering from celiac disease, which is a gluten intolerance, then you have a gluten-free diet. If you are suffering from lactose intolerance, you have a dairy-free or lactase enzyme supplementation. So these are the first line treatment for chronic diarrhea based on the underlying cause. All right. So if there's any chart, this chart is the most important chart for you to take home because it is a practical solution to your chronic diarrhea problem. Right. Then if your diarrhea is becoming disturbing to you, then you take symptomatic treatment. Right. Of course, if you're suffering from antibiotic or bacterial infection, that's a different issue. But if your diarrhea is actually suffering from severe symptom, then you can also choose to take some anti-diarrhea agent. The symptomatic treatment very often are only reserved for acute conditions. Most of us who suffer from chronic diarrhea doesn't come even to this issue itself because it is at this stage that we have to resolve the problem. Okay, now again, as I say, this chart gives you the overall summary of what are the diet you should take, for what causes, and what are the supplements that is advisable for you, beneficial to you. Now, it's a long list, but it's very important. Depending on the causes, these are the supplementation that's helpful, right? So I make it easy for you to see, but I will not go through it everything in detail. But just to highlight that you can see that in here, right? For inflammatory diseases, functional diarrhea, for these two, as well as the small bacteria, intestinal bacteria overgrowth, right? These three causes of diarrhea, probiotic play an important role in supplementation, right? But for bile acid malabsorption, lactose intolerance, gluten intolerance, digestive enzyme play an important role in solving the problem, right? Just to let you know and highlight some of the essential supplements that you should know. So it's not probiotic can take care of everything, right? In fact, digestive enzyme play an equal important role depending on what types of diarrhea you have yourself. Okay, right now let's go to the autonomy product that's relevant in the context of the diarrhea we discussed. So we mentioned probiotic is a very useful supplement. So in autonomy side, there's two types of probiotic. The powder form is probiotic 10 plus. The capsule form is autonomy SCI microbiome. All right. So you can see that the autonomy microbiome is actually in 300 milligram 60 capsule bottle, contain 8 strain of bacteria, and each capsule, the strength of bacteria is 10 billion CFU. This is about 3.3 times higher than the atomic probiotic 10 plus powder form, right? So therefore, if you want to have a high strength probiotic, atomic SCI microbiome is your choice of selection, all right? Now, what's the general application for both of these itself? Atomic probiotic 10 plus is actually for general health maintenance, right? But if you have a more serious specific condition, then actually autonomy SCI can be used for the therapeutic adjuvant itself. Now, so for most of us who are suffering from chronic diarrhea, actually autonomy 10 plus is suffice. It's generally suffice. But if you have some certain condition that you require treatment, for instance, you have inflammation diseases, bowel diseases condition, then you might want to choose SCI for that purpose. Okay, right? So you can see from here the 10 plus, as I mentioned, right? The application for 10 plus, the powder form is digestive health maintenance, right? Indigestion, chronic diarrhea, right? Eczema and gestational diabetics itself. These are the general application. For the SCI, which is the capsule form, right? It used for more more serious condition like C. difficile infection, Travers infection, diarrhea, upper respiratory tract infection, antibiotic associated diarrhea, radiation diarrhea, chemotherapy induced diarrhea, right? IBD, H. pylori eradication, and IBS as well. So you can also, of course, this the both are interchangeable. If you choose to use, if you want to have higher strength, by all means you can try it. All right. Okay, now nutritional support for malabsorption. We mentioned that one of the major complication for chronic diarrhea is actually the malabsorption. So it should not be limited to dealing with the diarrhea alone. We should also deal with the nutritional deficiency of the body as a result of people suffer from diarrhea. So in here, digestive enzyme, which is atomic fine enzyme, is one of the good enzyme that can actually help in people who suffer from malabsorption problem, right? Apart from that itself, actually the Power Vital Energy is a very good multivitamin functional drink, right? It will be better than a lot of multivitamin capsule in the market because of its high and efficient absorption in a liquid form, right? Then for malabsorption, as well as the loss of lack of protein, triple protein is a very good for malnutrition, malabsorption people who are actually suffering from weight loss, right? And also pure spirulina also is a very good natural multivitamin supplement, right? So if you cannot take vital energy, then take pure spirulina as an alternative for multivitamin supplement is also good for people who suffer from malabsorption. Okay, now the last few chart is talking about atomic fine enzyme. Now, fine enzyme actually is a very good formulation that not only contain full spectrum of enzyme, I'll show you, but it also contain vitamin B, which is very important in terms of one of the actually for your absorption. Now, in here, the key thing on the fine enzyme is that it is one of the very few enzymes that show a full spectrum enzyme. So which means that you have enzyme that is actually representing pancreatic enzyme function, as well as enzyme that we have, for instance, you see the lactose, right? So lactase. So people who suffer from lactose intolerance, taking this itself basically will help to actually reduce the enzyme lactose intolerance problem. So this is a very important digestive supplementation for people who are especially suffering from malabsorption syndrome. Okay, so here application: bloating, fullness, GI discomfort, symptom associated with indigestion and gas, malabsorption syndrome, muscle wasting, malnutrition, weight loss, underweight. Okay, that's the end of my session. I'll pass